So we are here today with Amir for his first MaxHarvest Plus hair transplant procedure. You've never had a hair transplant before, correct?
Yeah.
Okay. All right, so when we do the MaxHarvest Plus hair transplant procedure, we're trying to maximize that donor area. Instead of just doing a regular 30 centimeter strip, where if the patient has more length, we try to get it. If there's more elasticity available, we go for it. So it's a little bit more of a challenging recovery due to the extra tissue that's taken out. So you're going to be a good patient, take great care of everything?
Yes, absolutely.
Okay, excellent. Did you have any questions? Wow. You know what? I hate to say it, but I just impressed myself again. I love it. Look, it's on the money, man. That's what we call a perfect shot. Look at that. So watch. What do you think?
Sounds good.
You love it? Make sure, man. This is important. Okay.
Whatever you do, your eyes
Well,
you're the killer.
So what happens is that as we lose our hair, we go back this way, but we also go back this way.
Right.
So I have to make sure that this looks natural from the profile, and that way this blends in naturally. So I always get it as low as I possibly can get it, without it looking unusual from any of the angles as far as profile or something like that. All right. So what I do here is I create the frontal hairline by making tiny little one hair grafts from the top line to the back line in a staggered appearance, so it goes front, back, front, back, front, back. So it doesn't look straight the whole way across the entire hairline. It's all composed of tiny little one hair grafts. You blend it into the existing hairs over here on the side, so it blends into your hairs on the side. I do the same thing over here on this side. Okay. Then what I do is after I build the hairline with the one hair grafts, I put the 2-3 hair grafts behind that, and then I will use those stronger grafts in between to help create the density.
Right.
Now, this is my priority number one, is getting that front situated. That's what's going to change your look. It's going to reframe the face, make everything look different to you as far as your first appearance with yourself and as far as meeting others. So priority one is there. Priority two would be going for this bullseye. Okay. Everyone looks at this and thinks, oh wow, that's a small little area, just fill this. You can't do that.
It's a big area.
It's because if I just fill this and you lose the existing hair around that area, it creates an island of a hair which looks unnatural. So what we have to do is always blend into the existing hairs the entire way around to make sure nothing is unnatural between my grafted hair and your natural hair, so that doesn't come out unnatural when you lose more of your natural hair. So I create what's called a spiral. The spiral, I know you watch my videos, creates the direction angles of the hairs all the way around the entire crown. That feeds the directions and angles of the hair, so it covers it, right?
Right.
So priority one, this. Priority two is this. Okay. And what I'm going to do now is I'm going to trim the area where I get the donor from. Okay. So you'll be able to.
Are you going to shave this part?
I would love to.
Yeah. So.
Oh, please, thank you. So. Amir listened to my videos and he heard what a great idea it was to shave, and I couldn't be happier. It makes my job so much easier, but more importantly, it's also easier for the patient. The patient's able to take care of it much easier without the hairs in the way, so when they're washing it, it doesn't have the potential of dislodging a graft. It just makes it a much cleaner environment for healing, and it makes it overall a better process. Patients are able to wear a hat as soon as the next day, as long as it's regular clean. Alright, so let me show you what we're doing here, my friend. Okay, so what I do is I trim the area the entire way around. So I go from the one side all the way around like this, all the way around like this. So I take you from one side to the other side. Okay, so we just got through harvesting our patient Amir's donor hair. We were able to extract 3 separate half-centimeter strips. Let's take a look at what we did here. The whole process took us about 20 minutes or less. Okay, so it went absolutely perfect. How are you feeling?
I feel great.
Okay, how did you do for pain? Did you have pain during the process?
No pain.
So no pain, and it was as smooth as could be.
Absolutely.
Awesome. All right. Now we're going to put it in.
All right, we just finished up surgery with Amir. The whole process took about 4 hours from the time we went into the OR to the time we got out. What'd you think, my friend?
It was phenomenal. I thought it's going to be a lot of pain, but absolutely I felt nothing. I was very comfortable, and the staff were fantastic. Best staff I have ever seen.
Thank you very much. I appreciate that. So you didn't have any pain in the procedure. It was simple. It was nothing that you were very apprehensive before.
Absolutely not.
So let's show you what we did. We were able to go through and recreate the entire frontal hairline the entire way around. Just gently tuck your chin down a little bit. We were able to build all the way through the vertex, and I'm going to spin you around here, and we were able to get all the way into the crown. So tilt your head back a little bit for me, kind of this way, just gently back like that. Yep, excellent. And then you jump. All right, here we are with Amir. Amir is back for a suture removal after a MaxHarvest Plus hair transplant procedure. We moved almost about 60 square centimeters of hair 12 days ago. How was the process, my friend?
It's fantastic. I feel great.
Look who's back. It's Amir. We are at 5 weeks from the day of the procedure, and he just stopped by to say hello and let us check everything out. So what's been changing for you?
Everything, you know, I lost the crust, right?
Yeah.
And the hair is growing, and I just wanted to make sure like everything's okay and we're up to schedule.
Perfect. So you can see everything's nice and healed. There's no weird redness or irritation or anything really cooking. I'm going to just drop you down again and just show the rest of the suture line. So that's the suture line. And the little hairs will come out of that as well. And as you can see, looks great. Okay? So it looks perfect.
Come on in. Hey, look who it is. I'm here. Nice to see you, man.
No
Thanks for coming in.
How are you, man? Holy smokes! It works!
Yes, it does.
Wow! Congratulations!
Thank you, thank you.
How do you like it? Man, wow.
Yes.
You love it? What do you think?
I love it. I love it.
How has it changed your life?
It has changed my life completely. Very happy man.
And you lost some weight too.
I have lost weight.
You're a whole new person.
New person.
Let's check it out. So were the videos true?
Absolutely. 100%.
So you got what the video showed. You said, hey, I want that, and you got it.
I did. I'm very happy. I mean, I could not ask for more.
Oh man, I get so excited. I mean, look at what a difference a year makes.
Absolutely.
Just run a comb right through here. Everyone always is asking, is that real? Look at that. Look at this. Okay, so just kind of look straight up. So when we do that MaxHarvest Plus procedure, we want to reframe the entire way around. So all of this has been recreated with tiny little one-hair grafts, so it's super soft and natural the entire way around. So this way, when you look at him from a profile, you can see how it's reframed. He doesn't have that high recession. And you can kind of look at both sides here. So again, so nice and reframed. Now this is one pass, keep in mind. So if he does another procedure, we would just fill that in and finish him off. Now I'm going to have you kind of show the crown, so tilt back a little bit. Look at that. Look at that. Holy smokes, man.
Yeah,
that was wild. Alright, let me show the suture line. Wow. Okay. So, suture line. Everyone wants to see what's going on. This is my first time looking at the suture line. Same time as the camera's looking. He just walked in the door. So what we're looking at is, there it is. You see that line right there? I've got a little pointer for you. So, this line right here, that's the suture line. I just want to congratulate you again.
Thank you so much. Thank you.
And thank you so much for coming back in. I've gotten so many requests from my patients. I'm not even kidding. When's Amir coming back in? When's Amir coming back in? We want to see the follow-up.
Yeah.
And for you to come back in and follow through on that means the world to us. And I'm so happy that you look so amazing and it's changed your life for the better.
Thank you. It was a year ago on the August 17th, so I'm like 10 days or 12 days before
Awesome, man.
I actually had the procedure last year, so.
Congratulations.
Thank
man.
you so much, Dr.
You're
Bolton.
welcome.
I owe you so much. I don't know what to say.
Your happiness,
I'm so thankful.
your happiness, and you showing up as your payment man.
Thank you.
I'm so happy
Thank
for
you. Thank you. Thank
Awesome.
you. I appreciate
Congratulations.
it.